Welcome to the SCR Connection September webinar. Thank you everyone for joining us. It is my pleasure to introduce our guest speaker, Dr. Jessica Schwind. Dr. Schwind is an assistant professor in the Jianping Su College of Public Health at Georgia Southern University. Her current research interests include disease surveillance, capacity building, and risk communication for the prevention and/or early recognition of outbreaks. Through this research, she focuses on best practices for operationalizing the One Health approach and improving global early warning systems for disease detection and response by bridging the gap between digital databases and local health information. Last but not least, I'd be remiss if I didn't mention that she is also a faculty member of the NNLM Georgia Biomedical Informatics course, which is taking place this week. So we're especially glad that she was able to join us this morning. I'm now going to hand over control and let her get started.
Hi, everyone. Can you hear me?
We can hear you, Jessica.
Okay, great. So I am coming from Southern Georgia. Obviously, we have been dealing with a little weather issue lately, so hopefully everything will go smoothly. I will just be sharing the presentation now. So as Brian mentioned, I am an assistant professor of epidemiology. My focus is public health. I am a huge public health advocate, and I just love the opportunities that I get in order to speak about public health and really try to bring people on board. I'm really excited about talking about capacity building, specifically in public health, through strategic partnerships. I will focus on working with health sciences librarians, but I am open to talking about all different types of partnerships as it pertains to public health. And then feel free to ask questions as we proceed. So there are a lot of people joining in from all different types of backgrounds, so I just want to talk about some key issues and bring up a little bit about public health, what it is, what we do as public health professionals, so that I can make sure we're all on the same page. So first, what is public health? Well, health in and of itself is kind of one of those words that's really hard to define. The World Health Organization says health is not just the mere absence of disease, but also the presence of good well-being. Public health is defined by the CDC as the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. So that's kind of a pretty big definition, but public health is a pretty big idea, and when it's put to practice, it has a lot of different applications. So let's focus on a couple of different things. First, when we tend to think of health, we tend to think of the individual. When you go to see a doctor, the doctor is focusing on you as the individual and trying to work out a plan in order to improve your health. Instead, in public health, we're really focusing on populations. And we're not just focusing on numerous people, but we are looking at the connections between those people. So really thinking of people as a social network. And so you have a lot of individuals and individuals who make individual health decisions, but as a community, they also act in a certain way. And so in public health, we're trying to focus on the community, on a population level analysis. Now, as I'm recruiting students to join in the public health profession, I always say, why just help one person when you can help a whole community? And so that's really what public health is all about. Also in public health, you know, just like clinical medicine, we do focus on treatment, we focus on control, especially in outbreak scenarios, but the whole idea of public health really is prevention. So while we tend to respond to outbreaks as soon as we know something's happening, the idea of public health is really to prevent them from ever occurring. And so we do have a focus on treatment and a primary focus on prevention. And so when you think of public health, you probably think of things like immunizations or vaccinations, as well as healthy programs, say at schools or community centers. So we do love to focus on prevention, but because of various reasons, we sometimes can't take that preemptive approach, but rather we're taking a reactionary approach. Public health also focuses on intervention at various points in disease etiology. Now, this is very important. Disease etiology is looking at the causes of disease. Now, of course, let's take an example. Of course, we know HIV causes AIDS. But when we say the etiology of a disease, we're thinking about all the different factors that go into disease occurrence. So, you know, yes, we know that HIV causes AIDS, but what put that person to be, you know, in that position to contract HIV in the first place? So it's really taking a holistic or ecologic approach to disease occurrence. And so with that being said, we have three forms of prevention, if you will, in public health. We have primary, secondary, and tertiary prevention. Now, primary prevention occurs when public health professionals try to intervene before the agent ever comes in contact with the host. And so, for example, immunizations, that's the common form of primary prevention. Before a person ever comes into contact with, say, HPV, we would like them to be immunized against HPV. Secondary prevention is an early screening in the preclinical or early clinical stages of disease, and that's why we recommend, and by we I mean the public health discipline, we recommend mammograms or colonoscopies at certain stages of life so that we can try to find disease onset as early as possible, or in certain disease conditions before that disease actually manifests. And then tertiary prevention is, you know, the host and the agent have already interacted, there is a disease, but now let's see if we can improve somebody's quality of life through rehabilitation, for example, in, let's say, a stroke patient. So there are a lot of different areas that public health can act on when looking at the natural progression of a disease. And so what that means is public health really has to interact with a ton of different disciplines, whether it's basic scientists, whether it's information scientists, or whether it's people out in the community, because those are the key stakeholders, those are the people who we're trying to help. So a lot of different areas that public health can impact. So what is capacity building? So I wanted to talk briefly about capacity building because capacity building is a topic that I am really fond of, and I really view it as a calling. The definition of capacity, just in its broad sense, is the ability to perform functions, solve problems, and achieve objectives. So when we have the capacity in public health, that means we have the capacity to address issues as they come up. Now, that capacity can look completely different depending on your community or your population of interest, but building that capacity is something that is very, very important. And, you know, just highlighting this webinar, this is capacity building at its finest, because we are interacting and we're learning about new concepts, in particular about building partnerships across disciplines. So let's look at the different levels. So when you're talking about capacity building, you have three broad levels. You have individual, institutional, and societal. So individual capacity building, obviously the best application would be education. When somebody is educated about any topic, then that provides them the ability to respond. Now, when you're talking about issues in public health, when people are educated about what's happening in their community, only then can they respond to the issues that are coming up. Institutional. I happen to work in global health, and one of the field sites that I have is actually in Nepal, and I'll talk briefly about that later. But the institutions that are in Nepal that can address disease emergence are very different from the institutions here in the United States. Recognizing these differences, the World Health Organization actually came up with something called the International Health Regulations that says we need to have multiple institutions that are able to detect and to respond to public health emergencies, not just in one country, but in all countries. And so institutions play a very key role. Now, all of this together, such as institutions within a country, individuals who work within that institutions, provide an overall societal environment, or society that is conducive for an environment to detect and respond to public health emergencies or, say, disease outbreaks. And obviously any weakness, say at the individual level, will be seen at the institutional level, and any weaknesses in public health response at the institutional level will be seen at the societal level. And so just understanding how capacity building really has the ability to impact multiple levels is really important. So just talking a little bit about my research and sticking with what I know best is looking at the example of emerging infectious diseases. So emerging infectious diseases are just infections that have newly appeared in a population or have existed but are rapidly increasing in incidence or geographic range. So when we think about emerging infectious diseases just as one area of focus in public health, we can think of things like HIV, for example. We didn't really know what we were dealing with when it came on the scene in the 80s. Of course, we know it's been circulating for some time, for several decades unnoticed, but that is considered an emerging infectious disease of the last century. When you think about re-emerging infectious diseases, at one point we thought we were done with tuberculosis. Somebody said, you know, that's an old world disease, we're not going to have to deal with that. But of course, with HIV coming onto the scene as an emerging infectious disease, tuberculosis has rapidly increased in incidence due to the comorbidity of TB with HIV and its absolutely devastating impact on populations. So looking at building capacity in light of emerging infectious diseases, infectious disease capacity is really just the ability to detect and respond to infectious disease threats at their origin before they have a chance to spread. And so many of you probably were on high alert. Remember when the outbreak of Ebola was happening in West Africa? Obviously, containment and an understanding of the disease in the local area before it has a chance to go international was a huge concern. And that's simply because any weakness in any one part of the global surveillance network when focusing on emerging infectious disease is a gap through which it can arise unnoticed. And so obviously when from a public health perspective, when we are trying to prevent or predict the next emerging infectious disease, we want to have the capacity locally on the ground where it first arises before it spreads and turns into a global issue. Now, capacity building usually runs into difficulties, and these difficulties typically fall under three categories. Obviously, financial difficulties, that's something that we deal with in the funding climate today. But in some situations, in some countries, they just don't have the money to support public health. So again, oftentimes we are trying to put out fires as they occur, which is, we're trying to treat diseases, and we have very little money in order to address things preemptively. And so for that reason, public health in some situations tends to be the last pot that gets money. And so a lot of capacity building issues tend to come up, from a financial perspective. Secondly, political will to build capacity is lacking in some countries. And again, I focus on global health, but in the United States and abroad, we can see where building capacity is usually not in the forefront until something bad happens. And I use, since 9/11 just came up, there was a huge push, obviously, for the Department of Homeland Security, and 9/11 and all the events that happened there. A ton of money came into emergency preparedness at that point. And so, again, we tend to be reactionary, but in some countries, there's just not a political will to spend the money that they do have on capacity building and public health. And then finally, environmental. Using emerging infectious diseases as an example, the interface between animals and humans is what we call a prime zone of transmission of potentially catastrophic diseases. Now, HIV obviously has a strong primate-human link through SIV. Many emerging infectious diseases do have a wildlife and animal component. So when it comes to trying to build capacity to address emerging infectious diseases, environmental conditions actually can keep us from learning more about these diseases and building the capacity to detect and respond to diseases. Now, I have worked in Kathmandu Valley in Nepal, and it has its own environmental restrictions. I have looked at mental health in post-disaster areas in Nepal, and reaching these villages so that people can receive mental health treatment has been really hard due to the environmental remoteness. So environmental conditions in countries that do not have a really strong infrastructure can also cause really huge difficulties in capacity building. But I just want to re-emphasize that the reach of capacity building goes much larger than we think. So while there are a few of us here in this webinar, ultimately we have the ability to be change agents in our organizations. Those organizations can operate at the national level, obviously with NLM, regional levels, and then ultimately anything that happens at a great enough point is going to impact the globe. And so when you're thinking about, emerging infectious diseases or health conditions or just diseases in general, those that are caused by microorganisms, they don't care where our boundaries are. They don't care where we draw country lines or state lines or county lines. Microorganisms are going to spread. They're going to do what they do best, which is replicate, and they're going to affect all areas of the globe. And especially we have a lot of drivers in emergence, such as globalization, microbial adaptation, that really causes once isolated areas to really play a key role in the public's health from a global perspective. So who are the key players? So one of the reasons why I love public health is because you meet so many different types of people from so many different walks of areas of life, walks of life, and they have different backgrounds. They have a variety of educational degrees. They have a variety of interests. So public health involves the application of many different disciplines that can include biology, anthropology, public policy, mathematics, engineering, education, computer science, sociology. So many different disciplines come together and work in order to improve the public's health. Now, one thing that I do want to point out is a lot of people who practice public health in the United States today do not have a public health degree. Now, those numbers are changing, but for the longest time, public health was done by people who had a medical degree or maybe a nursing degree, but ultimately, there was a huge push, especially in the 80s, that really said, you know what, we need to build infrastructure for public health, and we really need to improve the public health workforce. And so there was a huge push to develop curriculum, offer degrees in public health, and so obviously that infrastructure is increasing. But all that to say, you don't have to have a degree in public health in order to practice public health. And so when I talk about information science or in particular health sciences, I really want to be very broad and say, you know, it's not public health professionals, us versus them, but really anybody can work in public health and anybody can make an impact on the community's health. So moving forward, I do want to briefly talk about the core functions of public health. And through this, I'm going to highlight the 10 essential public health services. Now, the 10 essential public health services are kind of divided up into general areas: assessment, policy development, and assurance, and research is something that links all of these areas. So let's talk briefly about assessment. So what is it that public health professionals from many different disciplines do? Well, the first assessment is they monitor environmental and health status to identify and solve community environmental health problems. Now, when we're talking about environmental health, I don't want you to just think of things like, you know, oil spills in the Gulf. I really want you to look at the word environmental and think community health. Okay, so think about all of the different factors that exist in the community that either increases or decreases a person's risk for disease. Okay, and then the second assessment is diagnose and investigate environmental health problems and health hazards in the community. Now, a really good example of when this occurred in public health history of the United States was with the Love Canal. You may have heard of Love Canal. It's a really interesting and sad story. But basically, it was an excellent example of public health professionals coming into a community and making things better. Now, it was very reactionary, but still they were able to enact change. So what happened in Love Canal was many years ago there was and I'm just shortening the story for time, but many years ago there was a company, a chemical company, that basically dumped toxic waste into a former canal. Then basically the company left the community and they covered up the toxic waste and you know, put a nice beautiful grassy lawn on top of it, but they did chain link fence around it to try to prevent people from being in that area. Well, eventually the canal started to break down. It was an empty canal, started to break down. I think schools were built on top of the area eventually, or near the area. Neighborhoods, of course, were built around the area, and the canal was breaking down and toxic waste was leaking. Now, this was not really brought to anybody's attention until people started seeing increased rates of cancers, lymphomas, and miscarriages in the community. They were like, you know, something's not right here. Why do we have a concentration of these adverse health outcomes? And so ultimately, they traced it back to being in the presence of this area. And this truly was an environmental issue, and I went on to establish the first Superfund site. And so anyways, very, very good public health example of assessment in the community. So then looking at policy development. Public health professionals that focus on policy development inform, educate, and empower people about environmental health issues. They mobilize community partnerships and actions to identify and solve environmental health problems. And then they develop policies and plans that support individual and community environmental health efforts. Now, a good example of policy development and how that leads to action is the development of the smallpox vaccine and the subsequent eradication of smallpox. That is considered one of the biggest public health feats in recent, history, and basically we were able, through concerted efforts, to eliminate smallpox across the globe. I think it's still housed in 2 areas, I believe, in the United States and in Russia, but for all intents and purposes, it has been eradicated. Now, there are different factors that went into why smallpox was able to be eradicated. Smallpox is only found in humans. It's not found out in nature, but there were a lot of dollars spent in ensuring that we eradicate smallpox. And polio is not too far behind as well. Now, polio is a little bit more difficult because there can be a wild type polio found out in nature, and we tend to see polio outbreaks in war-torn or conflict areas, and that's made it really hard to eradicate. But smallpox vaccine was an excellent example of how policy can be turned into action on the global level. And then looking at assurance, enforce laws and regulations that protect environmental health and ensure safety, link people to needed environmental health services and assure provision of these services when otherwise unavailable, assure a competent health workforce, and then evaluate effectiveness, accessibility, and quality of environmental health services. Now, in public health, there are so many different diseases or health conditions that you can study, and there's so many different factors associated with these diseases or health conditions. I am a program evaluator, and it doesn't matter, one day I could be evaluating a program about parolee recidivism and minimizing that in the community. And then the next day I can be looking at a school-based healthy weight program and evaluating that. It doesn't really matter the topic, the methodologies are really important. And so every single discipline has its own methodologies, but public health is just so broad that you have programs that have particular areas of focus, but you can apply successes in some cases across the board, but in other cases they really need to be adapted to the community. And so that's why you have this big emphasis on evaluation and assurance, because even though we promote evidence-based practices in public health, the way communities act can be very different. And so what works in one community may not work in another community. Here's another example of something that was really stopped outside of the United States before it had the potential to impact, but thalidomide. Thalidomide, this is an interesting story. It was actually, this pill was given in order to try to alleviate morning sickness. But the research that was done on this was in like the 50s, 60s, and 70s. The research that was done was not very thorough, and what ended up being uncovered was that prescribing this pill for morning sickness actually led to birth defects and congenital malformations. And so there was a scientist here in the United States, I believe worked for the FDA, who said, you know what, we're not going to allow this drug to be given in order to treat morning sickness because the research has not been proven. I cannot say without, you know, a shadow of a doubt that this doesn't cause birth defects, and so we're not going to use it here. And so the impact in the United States was minimized to a certain extent, and the largest impact was seen in Western Europe. But so that assurance sometimes we get from the FDA, and it's definitely a part of public health as a whole. So all of these different factors go into public health, and at the center of these factors is research, and this is really where innovative solutions is needed. And research really has the potential to impact all areas of public health. So that leads me to strategic partnerships for a truly interdisciplinary approach. Now, before I talk about the partnership between public health professionals and health sciences librarians, I really want to talk about what I mean between when I say interdisciplinary. So sometimes these words can be very confusing. So we hear transdisciplinary, multidisciplinary, and interdisciplinary. So transdisciplinary, the way that I like to think about it is it spans from the community to the bedside to the bench, the laboratory bench. Like it transcends boundaries in order to integrate sciences with humanities. Multidisciplinary is when you have a bunch of different people from different disciplines that come together, but they tend to stick with their own disciplines. So when I think about this in the terms of like a clinical context, let's say, for example, you have somebody who is diagnosed with cancer. Well, that person may go and see their primary care physician, then they may have an oncologist that they go and see, then they may need to go see a therapist, you know, but all of these meetings happen within the context of their own offices, okay? But in contrast, interdisciplinary is when you seek to harmonize between disciplines and really create a coordinated, coherent approach to any problem. And so a good example of interdisciplinary in the context of clinical medicine is when a person is diagnosed in the same room, in the same office, you may have a primary care physician and an oncologist sitting with the patient to discuss the plan of action, okay? And that's interdisciplinary. And so I really wanted to be very careful when I said interdisciplinary, because when working with health sciences librarians, or just even working with anybody for the public's health, I tend to prefer an interdisciplinary approach because we all have strengths and we all can work in public health even if we don't have a public health degree. And we can all have insights into public health simply because it's something that affects us, not just on a professional level in some cases, but also on a personal level. And those insights are very important when addressing public health issues. So there's so many different areas of intervention in public health, and I'm not going to, you know, say, well, we can intervene here and here and here, but I just want to give you kind of a broad look at all of the areas that we could intervene in, whether it was advocacy, whether it was outreach, screening programs, and just say to you that these are all opportunities in order to collaborate, in order to work together, in order to improve the public's health. As I was actually preparing this presentation, I thought that I found this from the Texas Public Health Association. I think a couple of years ago they actually had an annual meeting. Every state tends to have their own state public health association in addition to the American Public Health Association. But their meeting was entitled Public Health Optimizing Health Through Partnerships. And so if there's one thing I can say about public health as a whole, it's we are all about partnerships. We all recognize that public health does not occur in a vacuum. It does not happen in a silo, but rather it happens when people start to communicate and collaborate with one another. And so looking at how these different approaches can look like in the field, I just wanted to talk about the different things that I do in Nepal so that you can see how that interdisciplinary approach can look. So we explored resilience and other mental health outcomes after the earthquakes in Nepal, and through that we were able to work with people from different types of disciplines, psychologists, psychiatrists. Not only that, we had biomedical scientists working with us. We also had input from community elders, village elders, and we also worked closely with several nonprofit organizations in addition to the Nepali government, who gave us permission in order to carry out this research. So in order to do this research, we actually had to bring in a huge team of people, and we all had to understand exactly what our end goal was so that we could then discuss what does this collaboration really look like. Also, I work with health journalists in Nepal in order to see how they disseminate information. In developing countries, typically the largest source of information, health information, tends to come from the media or families and friends. And so understanding how the media communicates risk is something that I have to bring people in to really understand. So bringing in health journalists, bringing in key stakeholders, people who read these health event articles, and obviously public health professionals in Nepal as well. And then I am a huge One Health advocate. One Health is the idea that environmental, animal, and human health sectors are all related, and you cannot have one area that is weak without causing weakness in other areas. So if you have animal health, domestic animal health such as livestock, that is weak, then that provides an opportunity for infectious diseases to spread. If you have a weak wildlife health sector in the country, then that allows diseases to spread as well. And so this is truly interdisciplinary in that my main collaborators are ecologists and animal health, like veterinarians in the country. And I am in no way able to tell anybody about, oh, well, this is how you keep these livestock healthy. This is how you keep the wildlife healthy. This is where interdisciplinary approaches are so important to maintaining the public health. So with that being said, let's look at the public health professionals and health sciences librarians partnership. Now, obviously, one of the many ways that we're connected really are through information systems. Now, from a public health standpoint, you can access information systems for really two broad reasons. So one reason would be for research, your own research from a professional standpoint. And then two, you can access information systems for information to disseminate out to the community, okay? And because I'm an epidemiologist, when people ask me what I do for a living, I'm like, I just sit in front of my computer and crunch data and yell at statistical software programs all day. And so because I'm an epidemiologist, I tend to access these information systems in order to draw the data out and to look for associations or connections between certain exposures or certain outcomes. But I am just one small part of a public health professional workforce, in that many public health professionals access these information systems in order to get a good grasp of what's happening in their community, and then figure out how to disseminate this information to their community in the most helpful way possible. And so I can spend hours and hours talking about surveillance systems and public health and why they're done, and you know, what context we use them, but I'm not going to do that. But I did just want to briefly point out some of the key information systems we do use in public health, which is the vital statistics systems that looks at births, deaths, fetal deaths are included, also morbidity data, so sickness data. The National Center for Health Statistics gives a ton of information. We have information systems that focus on risky behavior. So behavioral risk factors surveillance system, or NHANES, also looks at risk factors as well. And then we have information systems that tend to focus on environmental issues, and then knowledge-based systems such as CDC Wonder, and then PubMed, which I know you're all familiar with. CDC Wonder is great in that it is an information system with a great user interface that tries to tie in a bunch of different systems so that it's more accessible to people. So it's kind of like a system of systems, if you will. And so public health information systems is really tends to be something that public health professionals and health sciences librarians tend to have in common. Now, I was briefly looking at the medical librarian competencies, and then I was looking also at public health competencies, and I just wanted to mention how we have several areas of overlap in competencies. Now, public health is kind of moving away from competency-based education and doing more of like a learning objective or learning outcomes approach, if you will. But I did want to point out that anybody graduating with an accredited public health degree in this country has to have some foundation in communication and informatics. And these are just some of the competencies that I pulled out of a long list of public health competencies. And you can probably look at these and say, well, yeah, I had to do the same thing too. I had to prove competent in the same area as well. And so you can see where, you know, you may even consider yourself a public health professional simply because you're like, yeah, I do these things every day. I gather data, I organize data, I manage data, I disseminate information to different channels every single day. And so I think it's a great opportunity to point out what we have in common. Now, I just want to kind of take the talk into looking at, well, where do we go from here? Since we have a lot in common, and we are all focused on improving the health of communities, which of course will then have a trickle-down effect to the individual, how do we use these partnerships in order to do that? Obviously, gaining information access is going to be a huge need. Public health professionals, whether you're, you know, an academic public health professional or you're actually in the field, you're working for a local health department, they are always in need for the latest information. That helps them to provide real-time changes for their approaches or their interventions in the community. That data, that information allows them to really achieve that evidence-based practice that we are always trying to do. But not only access to the information, I think another huge need is access to quality information. I really believe that we are in information overload. I can really see students just in the classroom feeling very burdened by the amount of information that they get, and not only do they need to read all this information, but they need to sort through it in order to say, okay, well, which ones do I need to listen to? Which ones, how can I critically analyze this situation in order to apply it to my situation? And so it's not just access to any information, but it's access to quality information. And then another area that I think needs to be focused on is really outreach and dissemination. So I'm going to briefly talk about my interactions and my collaborative projects with health sciences librarians, but I can really see that there is a huge need for improving overall user experience, whether that user is in the community, and I don't necessarily mean in front of a computer, but whether that user is in the community soaking up information, or whether it's somebody who is in a library, whether it's somebody in a hospital, that improving the overall user experience will actually improve the ability to succeed in outreach, so that people come back for more information, so that people can make evidence-based decisions. And so those are a lot of really broad recommendations, but that's really what I see moving forward. So with that being said, I want to talk about my past experiences working with health sciences librarians. So in the bottom right of your screen, I would like to introduce you to Code Blue. This is my team. We're a team of 5 people. Kathy, the lady on the left in the pink, she is the health sciences librarian who I worked with, and the 5 of us developed an online immersive training course in epidemiology. And what we did, and just to quickly introduce the other people, Jeff in the back, he is a multimedia instructional design manager. Ashley is instructional designer, and Erin in the front is a web and graphic designer. And Kathy is a librarian. And the 5 of us came together and we said, you know, how can we improve the online learning experience of students? And, you know, we have a lot of resources. We have a lot of disciplines represented here. How can we bring in the strengths of our discipline in order to address the weaknesses across the board in online learning? And so we actually developed a course where we immersed a student into a pandemic situation. And so they learned epidemiology, which is a core class in a public health degree in the United States. They learned epidemiology in the context of a pandemic. And so there was a lot of multimedia. We had an outbreak scenario. We said, you know, you're in this training program, you're a student, there's a pandemic occurring right now, get out in the field. And so it was a lot of fun. And Kathy in particular, her contribution to the course was amazing because she contributed to this immersive experience by providing a ton of resources that the students can use in order to improve their assignments. So for example, I had a little lesson on risk communication. They needed to not only relay the pandemic information to professional audiences, but they also needed to relay the information to the media. And so understanding risk communication from that perspective Kathy was able to provide resources that said, here's how you interact with the media in these scenarios of public health emergency. So that was just one example. Another example, I taught at the Medical College of Georgia for a couple of years, and we worked so closely with the librarians in order to teach evidence-based medicine. So typically in courses, we have, one course director. Well, in evidence-based medicine, there was like, I think 12 of us. There were a lot of people, and working together, we were able to really bring in library systems, and we were able to really merge the disciplines in the context of really providing treatment and help to individuals, in particular medical students here. Risk communication I briefly talked about, but working with librarians in order to really view them as communication partners. There's really an opportunity for developing, designing innovative product, because really communication is such an important key. So scientists, we can know everything there is to know, but if we don't know how to communicate that to the general public, who are the stakeholders in public health, then we're not going to succeed, no matter how much we work and how much research we do. And so providing services from that perspective would be super, super helpful. And so those were just some of my past experiences working with librarians in the context of public health. But also just from a personal level, I was thinking not too long ago, my first job when I went to college was actually in the library. I spent so much time in there. They offered me a job when I was a student, and I just love working with librarians, and I really view them as, and depending on the context, especially like public libraries, I really view them as the frontline workers for all matters to public health, because people tend to go to them for advice. So recently we had this eclipse that came through South Carolina, not too far from here, and we were able to go to the public library in order to do the healthy thing, which is get glasses in order to make sure, we don't ruin our eyes. And so at that point, that was a really big opportunity for librarians to participate in the public health, especially when it comes to eye health in the context of the eclipse. But it really provides an interesting perspective that we don't necessarily think about in different scenarios in public health, because everybody's so focused on local health departments or hospitals or clinics. But I think there's a really huge opportunity for collaboration and capacity building here. So I am open to questions, and I am happy to answer to the best of my ability.
Thank you for that wonderful presentation. We'd now like to open it up for any additional questions. We're we're running on time here, so if you do have any thoughts or comments after this session, please go ahead and send it to us, and we'll forward them on to Dr. Schwind. I'm so glad you're all able to join us, and I'm glad there weren't any incidents. I know there's been trouble with the weather over there. We're now going to actually stop the recording before a few final housekeeping items, so please stay logged on for a little longer.